Back here this evening, February is American Heart Month, the time for Americans to focus on their heart health and learn about the several types of conditions associated with this disease.
And tonight we are joined live in studio by Dr. Vic Graywall, a cardiologist with Cooley Dickinson Hospital. Doctor, thank you for being with us tonight.
Yeah, of course. Thanks for having me.
Of course. Well, many people take medications for their cholesterol. Who needs to take these drugs and how do they work? Are there new developments in this field that you're seeing right now?
Yeah, so, the cholesterol medication that everybody's heard of, the most commonly prescribed class of drugs, probably across the board, are statins. They're really effective drugs, especially at lowering your LDL and your triglycerides. They're not so good at increasing your good cholesterol, but exercise and dietary changes can help with that. Statins get a bad rap because they're very commonly prescribed, and so their side effects are common, just like any other drug. I encourage people to talk to their doctors. If you're taking a statin and having issues with it, we can always try a lower dose, or we can try alternative drugs that can effectively treat your cholesterol. In terms of new developments, there's actually a new class of drugs that came on the market in the last couple of years. We call them PCSK9 inhibitors. They're injectable right now. They're going to be tablets eventually, but these are really, really effective LDL lowering cholesterol drugs, and that's going to be the future of this field.
Yeah, I want to move now to taking a daily aspirin to lower the risk of heart attack or stroke. There's been some headlines that suggest it might not be beneficial for everyone, so where do we stand on that?
Yeah, historically, the idea of taking a baby aspirin as an adult for the rest of your life was considered really, to lower your risk of heart disease and stroke was considered a good idea. But, looking back at the data over the last several decades, we found that actually we were harming some people who were low risk for heart disease and stroke, and they were actually not really benefiting from aspirin. So I encourage everybody to talk to your doctors, your primary care, or your cardiologist. If you have established heart disease or you've had a stroke, you are not in the low risk population, you definitely benefit from staying on an aspirin.
What kind of effect does alcohol have on your overall heart health?
It's a controversial question, but unfortunately alcohol, is across the board shown to be pretty bad for us across all of our organ systems. In terms of the heart, it's a risk factor. Excessive alcohol intake is a risk factor for arrhythmias. It's a risk factor for a particular type of heart weakening of the muscle. But if you stick to moderation, so far the evidence shows that, although it's not beneficial to you, it's not causing too much harm.
All right, Dr. Graywall, we thank you so much for joining us this evening and providing our viewers with such insightful information.
Sure. Thanks for having me.